everybody, and welcome to this month's vlogcast. I am delighted to be in Cork at a first face-to-face patient forum we've done since December 2019 when we were in Glasgow. And even more, I'm really pleased to welcome Dr Clodagh Keohane, who is the consultant haematologist at the Mercy Hospital here in Cork. Clodagh, you've always had an interest in MPNs, and I wonder if you could tell us a little bit about your clinic in Cork and your interest in MPNs.
Sure, I'd love to, and I'm delighted to welcome you back to Cork, Nona. It's been far too long. So yeah, I have had an interest in MPNs since I was training, really, as a medical student, and then as I became a haematologist, I suppose found them very fascinating, and then I was very lucky to be able to, I suppose, do my specialist training in MPN with Claire Harrison in Guy's, and that's really where I suppose my interest was completely solidified. So that's where I did a lot of work on clinical trial and got to really meet lots and lots of patients with MPN. So I brought that interest, I suppose, back to Cork. I have a very busy MPN clinic based out of the Mercy University Hospital here, and we're very lucky in Cork in that I have a specialist nurse who works with me and has an interest in MPNs as well, and we're also very lucky to have kind of additional services like our psycho-oncologist who works very closely with our MPN patients as well.
How fascinating, because it's amazing how it's evolved over the years.
Yes.
And tell me, because Mosaic is one of the biggest research projects that MPN Voice funds. And for anybody who hasn't seen this before, it's a very big epidemiology study that is now also going to have sites in Ireland. And Cork is one of them. So Clodagh, perhaps you'd like to talk about that.
Yeah, so we're very excited and I suppose very delighted to be able to open Mosaic to Irish MPN patients. So we've worked very hard to try and secure funding, which is the main issue really in terms of being able to open and run the study. It's going to be open hopefully in the next couple of weeks in Cork. So based out of the Mercy University Hospital, and we'll be very happy to see patients from all over Ireland. Hopefully with time we'll have more sites open, certainly aiming to have a site in Dublin and in Limerick, but at the moment Cork is going to be the first site. So very proud and very excited about that.
I'm sure, and so are we, very proud and very excited to know that this is happening here. Where do you see MPN research going in future? I mean, we're doing an awful lot of research at the moment, and I just wonder if 5 years' time, where you'd like MPN Voice to be, and how, or MPNs to have evolved.
That's a great question, Nona. I suppose, you know, I think we've got much better at recognising symptoms related to MPNs and at managing symptoms. What I'd really like to see, and I'm sure, you know, I'm not on my own here, is making a big impact in terms of disease transformation and really trying to change the pathway or the progression of disease, to really pull that back and aim for ultimately a cure. So that's where we'd all love to be with.
Well, as an MPN patient who was diagnosed in 1991, I couldn't welcome that more. But it has evolved. The treatment has evolved enormously since then. Clodagh, thank you so much. And I can't tell you how much it means to be here in Cork again.
Well, we're delighted to have you.
Lovely. Thank you.
Thank you, Nona. Bye.